When having analyzed the research data, the results showed that the women showed both poor physical and mental health, and they lived in challenging psychosocial circumstances. They were also carrying high levels of responsibility for their families and home, and at the same time, they were struggling to establish themselves in Sweden. However, they also showed a lot of strength and resilience in trying to cope with the challenges that they met. They were also survivors of gender-based violence, something that was described to occur on both individual and structural levels, persisting from their home countries into their new environments in Sweden. According to feedback from the focus groups and the women, the reception at the Red Cross Treatment Center was positive. While the women reported experiencing positive health effects of the treatment, both healthcare staff and women also said that it was challenging. We also asked them about barriers for treatment, and several barriers were identified on different levels. Individual barriers to treatment for the women included issues of trust and fear of male healthcare personnel. They also saw and identified psychosocial barriers included women responsibilities for family and children and their home, concerns about finances, and uncertainty surrounding asylum processes, for example. On a structural level, the need for increased knowledge about refugee women was highlighted. Improvement suggestions were provided by both the women and the healthcare staff and included, for example, improving collaboration with other healthcare services and authorities, and enhancing the knowledge on how to address ongoing violence during trauma treatment. These apply to both clinical practice and further research. Clinically, there's a need to increase access to interdisciplinary treatment. We need to raise awareness of what available support there is and promote collaboration between healthcare institution and authorities. Efforts should focus on overcoming gender-specific barriers to care, for example, by offering digital treatment options and also providing support groups for women on rights, parenting, and peer support. Also, care planning should emphasize women's strengths. Future research should continue to explore gender-specific and culturally sensitive aspects of healthcare for refugee women, focusing on effective components in trauma treatment, long-term outcomes, and the role of peer support. Women should also be actively involved in research regarding them and development efforts.